Hello, I'm Dr. Whitty, and thank you for viewing the Cedar Male Medical video channel. Today we'll be discussing how to mix the HCG. From the clinic, you should receive a packet of supplies. These are the needles and syringes to mix and to inject the HCG. And the pharmacy will send you the medication. So the HCG will come in boxes like this and also with instructions from the pharmacy. The medications will be shipped from the pharmacy with instructions. Please note step number 3 has the amount of diluent to use. Most patients will use 4 mils or 4 cc's. These are the supplies you'll receive from the clinic. The mixing needles and syringes are in the pack here. In the package from the pharmacy, there will be a vial of sterile water as well as the powdered HCG. Before mixing, be sure you have the alcohol swab, the needle, the 5 ml syringe, and then both the sterile water and the HCG powder from the pharmacy. You'll want to start by removing the metal tab off of the vial for the powder. It will reveal the rubber stopper that's underneath. You'll do the same thing for the sterile water, so that the green tab here peels off and reveals the rubber stoppers. Next, you'll take the alcohol swab, and you want to be sure to wipe the top of each of the vials to make sure that they're clean before inserting the needle. Next, you'll take the syringe. Be sure that the end of the syringe doesn't come in contact with anything except for the end of the needle. Next, we'll open up the needle. These two come together and it's just a slight twist to put the needle on the syringe. After you put the needle on the syringe, you'll want to draw 4 mils of air into the syringe. Then pull the cap straight off and insert the needle into the middle of the rubber stopper of the sterile water. Turning it upside down, you can then inject the air into the vial and draw out the 4 mils of water. Please note, the tip of the needle has to be in the fluid in order for the fluid to come into the syringe. Then pull straight out. Next, you'll insert the needle into the middle of the rubber stopper for the powder, the HCG powder. It's vacuum sealed and it will actually draw the water into the vial. If not, no problem, just push in the water and then draw out 4 mils of air. Pull straight out and don't shake the vial to mix it. Instead, you want to just roll it and kind of swish a little. The powder will dissolve instantly. The powder has been mixed with the water. The HCG is now ready for use. This vial should last for most patients 1 month. You'll notice there's additional bacteriostatic water here that's not used. Please feel free to just discard that. And for the needle, be sure that the needle goes into a sharps container.